Hello everyone, I am Dr. Nidhi Nawani and I am an Ayurvedic consultant. Today I will be discussing about anorectal diseases. As I have already explained that there are commonly found problems in anorectal area are piles, fissure and fistula. So now today I will be discussing about what are the main causes for all these problems or what are the causes for anorectal problems. Now coming to anorectal diseases, the piles, fissure, fistula and especially piles and fissure, they are basically lifestyle disorders. By lifestyle disorder I mean that a lot of this depends on the kind of diet what people are having or the kind of occupation they are into or a kind of the lifestyle they're leading. By lifestyle they're leading I mean like whether the eating timings are regular, whether their bowel timings are regular, how is their sleep pattern, do they get up, are they sleeping late at night, getting up late in the morning. So all this comes under a particular lifestyle. Now coming to their eating habits, diet habits, like whether they are non-veg eaters or veg eaters, whether they take high fiber diet or low fiber diet. So all this comes under how are their dietary habits. Third very important thing is about their occupation. They are into which kind of work? Are they into field work, like where they are active, where they have to continuously travel, or otherwise they are into into a kind of work like call centers or BPO where they have to sit for longer hours, continuously 6 to 7 hours they have to be continuously seated. So whether they are into that kind of occupation. Then fourth is coming to their gender, male or female, because many a times they are this kind of problem, piles or fissure, they are genetically inherited also. So a lot of it depends on your gender also. Then at times like you are like in which stage of age, which stage of life you are, like what's your age, because many a times see pregnant women it is very common for them, almost 70 to 80% of pregnant women they experience some kind of anorectal problem, either a fissure or a pile mass during their pregnancy. Then if they have a history of overweight, so definitely people who are overweight, there is a tendency to get all these anorectal problems. Then their nutritional status, whether they are having nutritional diet or not. So lot of all these factors. Now coming to the lifestyle disorder, see all the things may not be under our control, but definitely our daily routine and the kind of diet what we take is definitely in our control. See, for example, in our diet, if we are having too much of junk food, by junk food I mean like deep fried items, your bakery items, spicy items, if you are having all those items, so that means it contains very less of nutritional value and very low fiber. Now if low fiber diet is there, definitely we'll get constipation problem, gastritis problem, and there will be so much digestive issues in our GI tract. So as a reason we might get these anorectal problems. Then coming to our sleep pattern, if we are not sleeping properly or we are sleeping late, if there is no fixed routine for our sleep, then also our digestive system, the digestive enzymes are not secreted properly, and as a result again we might end up having these anorectal problems. Then if we are not, if we lead a very sedentary lifestyle, if we are not active throughout the day, then also, because see what happens, if we are sitting continuously, the pelvic floor muscles, they will get very less blood circulation, very slow blood circulation will happen over there, and as a result again we might end up having anorectal problems. If the abdominal muscles are not toned enough, again it leads to indigestion, which further leads to these problems. So all these problems, all this lifestyle, inactive lifestyle, sedentary lifestyle, eating junk food, not proper sleep pattern, extra stress, many a times overweight, all this contributes many a times to constipation. So many of you might be aware, for all this, any person who has undergone fissure problem or is having fissure or piles problem, it is for sure that they might have undergone a problem with constipation, definitely. Out of 10 patients, 9 people, definitely they have an episode of constipation, and after that only all these problems they start. Now, how does constipation affect our anorectal area, or how does it causes that anorectal problem? See, it is very simple. By constipation, we means that the motion is too hard to pass on, and probably 1 or 2 days the patient will not pass the motion. Whenever they are passing their motion, they have to exert lot of pressure.